If you guys are in the addictions courses, you probably figured out that trauma is a big part of, addictions is a big correlation to trauma. And that means that people who have experienced severe trauma tend to be more vulnerable to addictions. Does anybody out there have an idea as to why that might be? Yeah. Kayla.
Cortisol levels.
Use complete sentences.
Sorry, I was like brainstorming.
Yeah.
Because when you go through a trauma, they'll try and find something to cope. So it's a lot easier to take a drink or pop a pill or to illicit drugs than it is to really deal with your problem.
Right. It's a way of it is a way of dealing with it, but it doesn't last long term. So let's say teenagers, for instance, who, let's say, had some trauma, some sexual trauma, and in that experience, they have thoughts and feelings and emotions that are overwhelming to them. So their friend says, hey, let's go out and have a drink, or let's experiment with drugs. Then through that, they go, wow, this not only gives me a high, I get tremendous psychological relief from my pain, from my emotional pain. Now, they might not be aware of it, but the way that they'll use these drugs and alcohol or other kinds of behavior can be sex, gambling, shopping, internet, games, will be more pathological in nature than their counterparts. And so what used to be the idea was that certain behaviors or certain activities or certain substances would make you addicted. That's not true. The research has vetted out that most people who engage in these behaviors do not become addicted. Now, I'm not giving you a free license to go shoot up black tar heroin, but it is definitely, we don't want to be under this guise that that's the only factor. Yes, heroin is highly addictive. We know that. However, in of itself is not going to create somebody who's addicted. There has to usually be other factors. It could be the only factor, but it's rare that you'll see it just by itself. And when it does happen, when it manifests just that way, it's a lot easier to get people off these drugs than when it's more complicated, what we call co-occurring disorders, when people have addictions, in addition to that, depression, anxiety, severe trauma, symptoms of PTSD, borderline personality disorder, attachment disorder. Those kinds of things kind of go hand in hand. And then you can pick up a third or fourth addiction, in addition to that. So it can get really complicated really fast. So touching on that, we're going to talk about how trauma, in terms of especially young adults, we'll see a lot of that. There's a few stats here I want to talk about here that, as I mentioned earlier, trauma and addiction are prevalent co-occurring disorders. However, in many addictions training programs, there is no training on how to work with trauma. This is a big problem. I would say that in most master's level mental health programs, there is very little training on how to work with trauma. If you are a medical doctor or a nurse, you deal with physical trauma all the time, right? However, you might know the signs and symptoms of shock, but not necessarily how psychological trauma will impact the individual. And of course, when you're injured severely, you're going to suffer psychological trauma. Especially because as medicine advances, what would have killed people in the past, they will live through. Which sounds great in some way, but in another way, just for example, let's take battlefield medicine has progressed to the point where you would see people sustaining injuries would never make it out of the battlefield. So they'll say, how come people in World War II and in Vietnam didn't have as much PTSD as in Iraqi war veterans? Well, the technology is better. They survive more severe injuries, and as a result, that has more of a psychologically traumatic effect on the individual. I just read in the paper I say the paper, but I mean the internet, because the paper almost doesn't exist. I don't get the paper. I just look at my phone. But it was a newspaper, or was at some point. And there was a kid from Syria who had a genetic disorder, and he lost 80% of his skin through this genetic disorder because they have a new genetic treatment, genome treatment therapy. They were able to remove some healthy skin cells, add a virus to it that corrected the gene, because they use the viruses to transmit the new genetic code into the DNA, and then grow sheets of skin in a lab, I guess. I don't know, on the back of a monkey. I don't know how it works exactly. I'm not a doctor. Then transplant it. They replaced all of his skin. Now, I don't know. I think that's great. They said he's running around playing soccer. He gets cuts and they heal. Great. But I don't know what that does to your mind, honestly. It's got to leave some nightmares, I would say, because he was in severe pain with no skin. So as we progress technologically, medically, this is great. We go to the farthest reaches of outer space. It does something to our psyche that we're not prepared for because we've never seen it before. It profoundly changed the human experience when we landed on the moon. Nobody had ever done this before. It had been a source of inspiration and for love and all kinds of deities, and then somebody's guy standing there looking at the earth and the other way around, you know. So this thing changes us, and as clinicians, we kind of have to be ready for these types of things. And what I would say right now, which is most salient, is that the level of abuse towards anything, and I like to think of drugs as really as just advances in technology, because the more potent the drugs are, it tends to be through some technological advance, right? Opium, but itself isn't going to do the same thing as when you refine it, or coca leaves, chewing on them isn't going to be the same thing as when you're snorting crystalline cocaine. The other thing that we have to be cognizant of is that trauma affects different genders differently. And just to be as progressive and inclusive, we can add a third gender, however you want to play that out. But we could say that there are people who are in between, for sure. That's a biological fact. If you study some of the recent findings, that actually Germany is allowing a third sex gender on their ID, and they said it's a long time coming. And if you look at just from a purely biological standpoint, there are differences in sexual expression biologically that would deem some differences. I don't want to get into a political debate about it, but at the same time, we as therapists, as helpers, we have to be sensitive and accepting to work with that population, any population, honestly. So it helps if you're a little bit more, you know, if you can slide into that a little easier than some resistance to those ideas, because whether you like it or not, you're going to have to work with these folks. And it's easier if you do like it, honestly. So in one of the studies I was looking at, 85% of people sampled who are addicted to in some form had one major traumatic event in their lifetime. Think about that. So all of us have had trauma, but then there's trauma, you know. We find also significant gender differences. I mentioned women reported experiencing more sexual abuse, and men reported more witnessing or experiencing violence. So just because of our social dynamics, you might see that more or less depending upon the gender. Okay, 1 in 4 children and adolescents in the United States experiences at least one potentially traumatic event before the age of 16, and more than 13% of 17-year-olds. 1 in 8 have experienced post-traumatic stress disorder at some point in their lives. I think that's a nice way to articulate it. Post-traumatic stress disorder is a disorder. It does not have to be persistent or pervasive through your lifetime. I think there's a common misconception that if you have PTSD, then you're going to be like that for the rest of your life. Or if you have an addiction, you're going to be like that for the rest of your life. But in fact, if you don't meet criteria for the disorder anymore, and I hear people say, oh, well, I've been in recovery for 17 years. Okay, well, I'm not sure what that means, but I know that if we try to, you won't meet criteria for a disorder. That's like saying I had cancer 17 years ago. But you don't have cancer anymore. Now, people will say, well, I'm an addict. Oh, that's fine, but we don't have that in the DSM either. We have a substance use disorder, alcohol use disorder, methamphetamine use disorder, or nicotine use disorder. We have disorders and we have criteria. We do not have addiction per se. It will be under NOS, not otherwise specified, with regard to sex, impulse control disorders, and things like that. That's just because the research hasn't caught up with life. We keep getting new disorders, but we don't have the time to put out new names for them all the time.
How often do new DSMs come out?
It depends. There was a big. So we're on the 5th edition now, and I think the 3rd one was done in the 70s. The 4th one was done in the 80s, and it had an update in the 90s. So really, it depends on the APA's resources and time, because they get like people from all over the world studying this stuff, and they contribute in these big meetings. But and while it's important for us to be able to identify what our patients are suffering from, it isn't always helpful to focus on that, because everybody needs a little bit of help in a little bit different way. Sometimes it can help, especially with addictions, but if you get focused on disorder or what's wrong with them, it's like cancer. You can get cancer any number of ways, right? And the treatment, while it might be similar, is going to be different for each person depending on their age, how they contracted it, things like that. So it's something to keep in mind. It can help, especially early on. And nowadays I can talk to somebody for 5 minutes and I can get disorder out of you, sometimes 2 or 3. But how does that help me? I don't know where they're at. Just because they're like that doesn't mean they don't want to be like that. So I have to figure out where do they want to go, and then tailor my treatment around that, keeping in mind some of the things that I'm seeing. But it isn't always useful, because I could say, well, you sound like a really selfish person, and if you were less selfish, you'd probably be happier. Well, that's not up to me to tell them where to go, right? They come in and present with an issue. I try to find goals and treatment outcomes that are going to help meet that goal. I want to feel less depressed. Okay. So, okay, a little bit more stats, and then we'll kind of get into the meat of everything. A national survey of adolescents who had experienced physical or sexual assault were 3 times more likely to report past or current substance use than those without history of trauma. So, what happens? What's your name again,
Maria.
Maria, that's what I thought. You have kids?
I have a 19-year-old.
Okay, so if you were 19-year-old when she was 12, started using drugs, the first thing you think is, oh man, I'm gonna whoop her, or, right?
Yes.
Okay, but this can be a sign of trauma, right? Could be. She could be just being a teenager and
Rebellious.
right. But if they kind of stick into it, like, I've had a lot of consequences. I got my relationship with my mother is not good. Well, my school, friends. If you're sticking with that, there's probably something more pathological at its base, and that's something to consider. So when we approach them as a clinician, I'm not looking at the drug use as a moral issue, a moral failing, because a lot of times we do. I do personally, but I try not to look at my patients that way because that doesn't help them. But to see, where's this coming from? How come the use is there? Why is it so often? Did your friends use this much? If not, why? So, okay, let's see. In another survey, adolescents receiving treatment had more than 70% of patients had a history of trauma exposure. I don't know what that 7-8 means. It's like a misprint. So 70%. That's almost on line with adults, which we saw. What was it, 95% or something like that? Think about this. I will tell you, when I was in my training, they never talked about trauma. we talked about people and their behaviors, but behaviors are just symptoms of underlying conditions. And if we don't get to the root cause of that, they're going to have relapse. And then what we do is we blame them and say, see, they're not getting it. They're not doing the program right. They're not learning. Well, when you have severe trauma, it does a lot of things to you. And this little chart here, this little pyramid here, shows kind of what happens when you have an adverse childhood experience. Now, everybody has an adverse childhood experience. We want to think more of the extreme, right? Disrupted neurodevelopment. Wow, that's a big one. You think that's going to affect people's cognitive functions, emotional regulation, and interpersonal relationships? Huge problems. Now, just because they have neurological development doesn't mean they don't have thoughts and feelings. They still do. They're not integrated with the rest of their system. Social, emotional, and cognitive impairments. And the adoption of health risk behaviors. So risk-taking behaviors. It could be early exploration into sex, with not really having that emotional maturity. Doing dangerous things, which most teenagers do, is because they're still growing. And then above that, if you have risky behaviors, you're more susceptible to disease, to disability, and to I don't know what that says. Social problems, sexual problems, social problems. That's kind of inherent, right? So, and then early death on top of that. So this is how it starts. They get you here, and then that's your payoff, an early death. It's a tragedy. It's sad because people didn't ask for these kinds of experiences. They were put upon them. Okay, we're going to discuss some specifics about psychological trauma. If anybody has a question as we're going forward about the material, please interrupt me. That's okay, and we can talk about it, because I'm sure if you have that question, other people might also. So just to have a shared definition of psychological trauma, we're going to use the American Psychological Association's definition, but it does come up short. So psychological trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Long-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. While these feelings are normal, some people have difficulty moving on with their lives. Now that doesn't really say what trauma is. It is explaining a causal relationship, but trauma doesn't care about time. You could be traumatized 40 years ago, and you're still feeling the effects of it, because the mind and the memory don't have any. It's not like it wears away. People say time heals all wounds. Sometimes that's true, but some of these other ones, they're just as new and fresh as they were the day before, the day it happened. And a lot of times you'll notice this. People's reaction to their trauma is how they react with life. So let's say I was a young boy and I was abused by my parents, neglected, ignored. My needs were not met. So I have a fear of people that I'm close to. I'm afraid of them. I can't make new connections because I think those emotions I have towards closeness with people give me feelings of fear also. So you can see how this has a real damaging effect on the individual's life process, because we don't live like in silo. We're not like snakes. We live together in social settings, but these people are separated from the social experience because they feel uncomfortable being around just themselves, other people. And so I think it's important that we're cognizant of it. And I guess more importantly, I want to deepen your compassion towards addiction, because there is such a negative attitude. People will look at people who have used drugs or have been addicted to alcohol or sex, as if there's something wrong with them, that they're a bad person, and shame them. And a lot of previous treatments did focus on shaming people. We know that's not an actually good way to work with people's shame, because they have enough shame. We don't need to add to it. One of the things he mentioned was, and I know especially in Nevada, we have a lot of Native communities. They call them Native First Nationers, and in Canada we call them Native Americans. But in any case, Indigenous people. When he mentioned that that they're overrepresented in index to different cultural peers in their addiction, there's a very strong component or correlation between a lack of some spirituality and spiritual life of the individual and addiction. And when that's missing, you'll see it very strong. And a lot of times that's why 12-step methods or those support groups do try to involve and incorporate spiritual development, which can be really helpful. And I wouldn't neglect that. I always try to make that part of my treatment. Whatever their spiritual or religious value is, I try to tap in and encourage that. If we look at the native peoples, especially of the Americas, we see that their deities were natural deities, right? The rocks, the streams, the sky gods, the earth. Now I want to say the American government or whatever. My parents are from Mexico, but I feel just American as anybody else. So we'll kind of force them off their land. So force them out of their spiritual realm. And this is like taking away somebody's church. So because of that, I think what is one of the main reasons they're so disoriented as a people, and they have to kind of reestablish that. I've worked with a lot of Native folks, and they will definitely say they go back to their roots to get over these kinds of addictions. They go back to the stories of their grandfathers. They start learning the language, practicing the cultural heritage, and those things really do ground them. And so we see people who don't have that grounding, and it doesn't have to be Native Americans, it can be anybody, any culture, race, ethnicity. Okay, so any questions about that before we go on? Did anybody have any comments or thoughts about what Gabriel Mate was talking about?
I do.
Yeah.
I have a little bug in here that confused me a little bit.
Okay.
Only because some of the reading had led me to believe that it was genetics.
Right. And he said it's not your genetics, right?
Yes.
Yeah. So genetics does play a factor.
Right.
But I think he's saying the environment is more of a factor. We know that folks with addictive disorders tend to have it in their family, and they tend to have a differentiation on the D2 receptors. So some of those neurological receptors on how they process dopamine is different. But what we know about genetics now that we didn't know before is genetics are not static. You are not born with a set of genes. You are born with a set of genes, and the environment will reprogram them accordingly. So we have this genetic type, genotype, and then we have a phenotype, which is a potential for variation in the genetics or activation of certain genetic code that's latent until the environment maybe elicits that. So let's say you grow up in a violent environment. You're going to learn how to be more violent. And your genetic makeup will make you quicker to respond to threats, where in a more civilized society, we tend to be more latent about these things, which gets us killed sometimes. So there is a lot of change in how we understand those things. And I would say that it's an old way of looking at addictions as cause and effect, but interrelationships between different causes and different effects: environment, stress, individual history, social support, level of education, poverty, all those things in combination. And so some of the new stuff coming out of Harvard it talks about addiction as a syndrome of things. Just like AIDS is autoimmune disorder syndrome, you don't die from HIV, you die from lack of an immune system, and then all the complications that come with that. You get really susceptible to any kind of illness, and then you could die from those kinds of complications. So that's what I would, it's really important to start looking at, because if you just focus on the substance or the behavior, you're going to keep telling them stop using it, and then let's say they do, they still have all kinds of interpersonal problems and emotional pain, and what do you just leave them there like that, and then they relapse because you haven't given them the skills and or support to overcome those things, and you're like, well, see, it's their fault. No, we have to work more holistically with the patient, and that's so important. And thank you for bringing that up, because I think when I heard it, I thought the same thing, but I'm like, yeah, with the new stuff, you know.
Thank you.
So thank you for giving me the opportunity to explain that. Any other questions?
I wanted to bring something up. I really liked how he was talking about, he didn't really say that there was a cycle, but that's kind of what I got from it when he's talking about how when parents, if they have an addiction and they don't show their kids enough attention and they show the addiction more attention, then that can cause the kids to then do that type of behavior later on, and then it just keeps going.
Yeah, it isn't. It is that is a good point, and it is almost like a virus that you pass on psychically, right? Because even if the kid, it can even skip a generation and still be present. And I attribute a lot of that to wartime experiences, like the whole country when World War II came in Vietnam, the whole war had come to this world, right? Everybody was affected in some way, and if you didn't go to war, when your family member came back, they were going to impact you. And when you're suffering from that kind of trauma, back then they didn't know what to do. People just drank incessantly. Drinking is part of the military culture, like it or not, and it's encouraged in a lot of ways. So they get violent, maybe they beat their children, they beat their wives, commit homicide against a family member, all kinds of things crop up, and so nobody gets away from it. That's why it's so important for us to take care of not only our war veterans, but also find ways to mitigate war, so it isn't, you know, the only thing we do. I saw a comedian the other day. He said, America has military bases in over 80 countries. He said, Europe doesn't have any because they're selfish. He was making a joke, but at the same time he was saying, why do we have 80 military bases in different countries? Like, that seems like we actually are all over the world. Now, I work with a lot of military personnel, veterans and active duty, and they have a very special culture, and I respect and honor that. But at the same time, we know these kinds of experiences have a profound effect on the individual, and also very young men and women, right? The majority of the population, the average age of military personnel, the average, if you take it all together and average it, it's like 24 years old, because so many very young people go in there. They don't have a lot of life experiences. They don't have a lot of emotional resilience yet. They haven't seen a lot of the world yet. They're all of a sudden in a foreign country doing all kinds of really difficult things, sometimes committing violence, sometimes being victims of violence. However you want to categorize that. And that has an effect on their family members, their friends, and our society as a whole. You know, I lived in Nevada my whole life. Guns are very common here. They always have been. People open carry. I was in the Boy Scouts. We were shooting. But you can see how those kinds of attitudes and towards violence, people would rather see somebody get killed on TV than see somebody have sex on TV. That's all I'm saying. Like, there's something wrong with that picture. Because why, you know, if you showed violence in a classroom, let's say where you work in a middle school,
the kids are getting into it though.
But if it's sex, you lost your job. Now, let's think about that value. You know, if you kill somebody on purpose in this country, you get about 10 years. Premeditated homicide, on average. If you rape somebody, it is a life sentence, most of the time. It's something weird there. I'm not going to judge it, but I just want to highlight and think about it, you know, because it has something to do with our subconscious as a people. because in Europe it's different. If you spend some time, they're more open sexually and less open to violence. They're much more adverse to violence than we are. The things that we see on TV, they're like, whoa. And then I go over there and turn a commercial on, and there's a naked woman. I'm like, what's going on here? So, we could debate that. But the point I'm saying is that violent experiences have an effect on not just the individual who suffers through them, the trauma, but also the surrounding community, his family. If you look at some of the symptoms of PTSD, intrusive memories, the symptoms will tell you about what's happening inside the individual. So if I have an intrusive memory that keeps coming back and I can't seem to control it, it's trying to get somewhere, but it's stuck. It's like replaying itself over and over. And Freud said that the psyche will try to master an experience by reliving it. We see this in relationships, right? You marry your dad, so to say, or you date guys that remind you of your mother, or women, whatever. And you're trying to fix the relationship that you had, the dynamic, and it's not. And I've seen it over and over and over, and you don't even know it. You don't even know why you're attracted to this person. It's a subconscious level. There's a dynamic. There's an unmet need. There's a desire to resolve this issue, but it doesn't happen. But you keep picking the same guy. Like, let's say a young lady who dates men who are not emotionally available and tends to cheat on her. And if you look at her life history and her father, you see that same pattern of behavior. And I'm not picking on women. Guys do the same thing. Trust me. But I'm just using this as an example. But if you use the same actors and the same players, you're going to probably end up with the same result, more than likely, unless you change and grow, and which can happen, but it takes a lot of effort and time, and not everybody's interested in that. So we're trying to reprocess that, those memories, upsetting dreams, trying to process that thing, but we don't let ourselves, we wake ourselves up, when the scary thing comes. We don't let it play to its finish. Trying to avoid thinking or talking about the traumatic event, avoiding places and situations that make you feel like that, feeling emotionally numb, just checking out emotionally. You can shut down, you can use drugs or alcohol, or you can do it psychologically. Trust me. If I'm in an argument with my girlfriend, all of a sudden I don't feel anything. I'm like a robot. Yes, I'm sorry. No, leave me alone. So I have to work. Stay present. Okay, wake up. Yeah.
I don't want to go too far off topic, but is that what they call stonewalling?
Yeah, sometimes.
I keep reading that word and I don't.
Well, no, stonewalling can be blocking. Like if you want to talk to me about an issue and I'm bringing up another issue, so or just maybe going off topic, but I think it can be similar to that.
Like avoiding the conversation.
Yeah. That would be avoiding it, but you think the other person's messing with you, but they're just trying to cope.
Right.
They're not even aware of it sometimes, because when we're in highly activated states, it's hard for us to process emotions. That's why in the comfort and safety, hopefully, of a therapist office, you can open up where you can't process always in a conflict in relationships that are sometimes really latent with conflict. Let's see, feeling hopeless about the future, that's usually a sign of depression. Memory problems. You know how you have to try to remember things? You can also try to forget things.
I have to write everything down.
Yeah, that's just welcome to 40. My memory used to be perfect, and now I'm like, I can't see this, first of all, and now I have to write it down. So a lot of times with trauma, you'll see a lot of forgetfulness or gaps in their memory. I don't remember this. Well, it's kind of like when you drop your computer. Your computer had a traumatic experience, right? It also, in that moment, didn't record everything on the hard drive well because maybe you damaged some of the circuitry. Same thing happens with the brain. If you're getting knocked around, your memory isn't going to be really good about that event. So there's a misunderstanding of what happened to the events. There's it's almost like a broken up image, and you don't really know what happened. So sometimes when we're working with patients, we're going to develop some kind of narrative for them to wrap their mind around. It may or may not be accurate, but it's enough to help them process the information. Sometimes we have to go to witnesses. What did you see? Oh, no, you actually tried to help that person, but you were knocked out. And you might think, oh, I woke up and I didn't even do anything to help this person, and you have a tremendous amount of guilt. So sometimes we have to put those pieces back together. Sometimes we have the information. Sometimes it happened 30 years ago in the jungle of Vietnam, and we don't have any way to get there, but we use imagination to fill that in. We don't create memories. We can't do that. People know the difference between what they imagine and what they remember. But we do use it as a means of healing. Trouble concentrating, difficulty maintaining close relationships. Well, a close relationship is, what's requisite of a close relationship? What do you have to have? Trust, right? If you don't trust people because people hurt you, how are you going to open yourself up? Also being vulnerable, right? Which is a part of trust, because you're allowing them to see you without your mask on, which can be very uncomfortable. I was watching this documentary about hair extensions,
Oh, yes.
Yeah, and this woman said, I'd rather let somebody see me naked than without my hair. And I thought, wow, that means that she must feel so vulnerable without that hair on, and how it must be hard to connect with her because of her hair. I don't know. It seemed very odd to me. Something I didn't think about, and how it affects different cultures and different lifestyles and things like that. Symptoms of anxiety, increased emotional arousal, which may include irritability or anger, and then overwhelming feelings of shame or guilt. So this is how they feel on a day-to-day basis. And now they use drugs and alcohol to numb their brain out, because when their brain's numb, they don't feel a lot of these uncomfortable symptoms. But what do you think happens over time if you're always numb? If I numbed your senses, if I numbed your eyes, your senses to smell, taste, touch, hearing, what would happen to you?
You forget how to use them.
What else? How would you function in life if you couldn't use your senses? Well, could you drive?
No.
You'd ram your car into something, right? If you could find your car, you couldn't hear people talking to you. Now think about your emotions as a sense. That is the sixth sense, right? Everybody talks about like it's some ESP. Yeah, maybe that's the seventh one. I don't know. But I know that our emotions are signals that tell us how we feel about situations, people, ourselves, judgment upon our actions. But if you are numbed out psychologically or emotionally from abuse of drugs and alcohol, and it numbs the frontal part, frontal lobe, so you don't feel it, you don't process those emotions, and then you don't know how to regulate them very well either. So you go through life blind. And a lot of people that I work with in addiction will tell me, I wish I didn't have emotions. I'm like, no, trust me, you want those. It's like saying, I wish I could pluck my eyes out. You need them. But I'm going to teach you how to use them, and then you're going to like them, because they're your ally, and they give you information about the world around you. And they actually let you, experience deeper things. Things that are like poetry and art and subtle things, like sharing a sunset or a sunrise with a lover. These kinds of deep emotional connections are so important. Now, this is kind of a gross image, but I like to use it because I think it helps you remember. So we know that people can be psychologically injured. Just like this little boy scraped his knee. I don't know where I'm pointing here. He's going to heal from that. But this other guy on the right, he's got a large flesh wound here. Can you guys see this? No?
I can't see nothing. Okay.
Let's change it back. I don't know why it changed. It changed after I stopped the video for some reason. Okay, there we are. So this other wound here is going to require a medical intervention, right? And just like certain traumas people will recover from, certain experiences, other more severe traumas are going to require intervention from a mental health provider, a psychologist, psychiatrist, somebody else is going to have to help you through these things. And this is going to take us to, you guys know I like to tell stories, so we're going to talk a little story about what I like to call a psychological truth. And these come from the mythic world of the Greeks. Does anybody remember this character here? Medusa, right? So this is a woman. She was a woman, and she's now this monster. She has hair made locks of serpents. Her body is that of a serpent, and she lives in this cave all by herself. And if you look at her, she turns you to stone. But she wasn't always this way. She was a priestess in the temple of Athena. And she was so beautiful that her beauty kind of cast a spell on Poseidon. This is the god of the sea. And he took her. He raped her, essentially. And then, because of this experience, it grew the jealousy of Athena, and she punished her and turned her into this beast. So the Gorgon, which was these three sisters, was not made out of the Terror. The Terror was made out of the Gorgon. And it's important to remember that, because a lot of times people who have experienced severe trauma do terrible things to themselves and other people sometimes, for lots of different reasons. And we need to cultivate our compassion towards them and working with them, because it is very common that folks are blamed for their trauma, right? With victims of rape, it's even to this day, it still happens. People are shamed by medical staff, by police. They're often not believed by their parents or their loved ones. And what do you guys think that's about? Why? What would somebody have to gain? Nothing to have to admit this, but what do the other people have to gain by not believing that it happened or somehow blaming the victim?
Not feeling responsible, not taking responsible. It's like, put it on someone else.
Yeah, or assigning blame somewhere where they can do something about it. Yeah. It is so horrible to imagine that if somehow they are responsible for it, it's less horrible. Does that make? It almost doesn't make sense, but it does in another way. If you die of a drug addiction and you don't blame the society that put you there, in a way, because we neglected you as a child, we neglected you in the education system, in the medical system, in the criminal justice system, and all these people kept doing these terrible things to you, and you finally die. We say, oh, see, look what that person did to themselves. It's a way of mitigating our own internal sense of what we call this disequilibrium in ourselves. We try to, blaming is a way of discharging a negative emotion, so we can, without having to sit with it, because it's just unbearable. This happens a lot, not just with victims of sexual violence, but other types of trauma. And so this is what happens. So she becomes this monster, so to say, and she is relegated to this life of loneliness and misery, which is a lot of time what happens to people when they are victims of trauma. They feel ugly on the inside. This was a personification of the rage, the hurt, the destruction of what was beautiful and innocent before. And so there's this hero, Perseus, and he needs the help of Athena to vanquish this monster that's tormenting his seaside homeland. And so she tells him, if you go and get me the head of Medusa, and you use this as a weapon against this monster, it'll turn him to stone and you'll win. And then as a compensation, I want her head. And you'll see many effigies and depictions of Athena with Medusa's head on her shield. or on a spike on her lance, and or spear, and this is one of her powers. So Perseus goes to. She warns him too, and first gives him a shield and says, "Use this shield. Do not attack her directly. If you do, she's going to turn you to stone. Use the mirror inside of this shield." It was a finely polished metal, so it acted as a mirror. And she said, "And look at her through this reflection, and then use your arrow to strike her, or cut her head off." I think he cut her head off with a sword. So this happens. He goes to her lair. He remembers what Athena told him. He uses the shield. This is an analogy of how we work with trauma. We do not attack it directly. Maria doesn't come into my office, so she suffered some kind of horrible traumatic experience, and I say, "Okay, sit down, let's hear about it." That isn't going to work. She's going to close up. She's going to feel violated by me, asking her to conjure up all these thoughts and feelings about this thing she can't even process. And we haven't developed any kind of relationship yet. There's no safety, no trust. But this is what happens with clinicians who are not trained to work in trauma. They say, "Well, tell me about when you were molested by your dad when you were 8 years old." The reason you can't remember those things is because your mind is psychologically protecting you, because if it opened it up all at once, you'd have a complete breakdown. So the mind has its own process of healing. There's my dad, he grew up in Mexico, and they didn't have access to penicillin and certain kinds of vaccines when he was growing up, even though they existed. So tuberculosis was more common when he was growing up. And one of the things he told me is that the body tuberculosis attacks the lungs, the respiratory system. The body can encapsulate these lesions inside with calcium and keep the virus in stasis. But when people get older, their body needs calcium, takes it back, and then the illness progresses. And that's a way I was thinking about. Sometimes trauma does the same thing. The mind wraps a veil around it so it doesn't have to help manage what happened to them. And so to strip that away from them without giving something in its place, a skill, a way of them to emotionally ground before they process, is violating them all over again. So important that if you're dealing with somebody with trauma and you don't have the training or expertise, that you don't do it. You refer them out. But what would happen is they would just get them into therapy and say, "Stop using your drug." Well, the drug and alcohol was keeping you alive because you're starting to remember stuff now that you don't want to remember, but you have no way of dealing with it. And then you tell them that they are not getting with the program and they're just not committed to the sobriety, and that's why they're using drugs and alcohol. No, we missed something here. We missed that there is a profound traumatic experience this person has endured, and this is a symptom of that. And without them giving them the proper treatment, they're going to go back to their previous level of coping, which in this case was drugs and alcohol. So we have to come up with a detailed plan. We have to explain the plan to them. And this is why I have you guys work on treatment plans. Now, I would tell you, this lecture is part of a graduate course that I taught at UNLV, but I also taught it to my undergrad students because it was so important. I don't need them waiting till they get to graduate school to figure this out. They need to be introduced to this early on. So having been in the field, I recognize this was an important aspect of training that needed to be introduced early on, so you guys started to get this into you're able to incorporate this into your education and training. Now we have Perseus vanquished Medusa. Remember, she was raped by a god, Poseidon. She was pregnant, and when she is slain, two beings pop out of her. This is how it happens in myth. It's just kind of magical. One is Pegasus, and Pegasus represents freedom, right? Everybody, if you're on a winged horse, you're going to feel free, right?
Yes.
Everybody wants to be on the back of Pegasus right now, right? Now, because if you overcome the trauma, now remember, the personification of the trauma was Medusa in this case. One of the things it offers you is liberty and freedom, a sense of a new life, right? The second thing is is her twin brother, Creosaur. He's a golden warrior. Truth. He represents truth. So these two things. Remember how I talked about how a lot of times people don't remember what happened? They aren't able to understand the events. They have flashbacks. Once the trauma is eventually processed, and I won't be able to get into the techniques that we use, I'm just getting kind of to the basis of it. This is just very basic because we don't have time. This would take me a whole semester to give to you. They have a sense of what really happened, of, the past is now the past. The past isn't present, because a lot of times if you have been a victim of trauma or an experience of trauma, you feel like it's happening or it's gonna happen again. It's just around the corner. You never feel quite safe. Well, if you don't feel safe, you don't sleep. If you don't feel safe, you don't want to be around people. As Gabriel Maté said, he referencing Artie Lang, the psychiatrist from Great Britain, people are afraid of themselves, other people, and death, right? If you're afraid of other people, how can you feel safe? We feel most safe when we're connected to others. We feel kind of safe when we're alone, but we feel still disconnected. So a lot of times you'll see isolation from people with trauma. They don't feel safe, but they can't approach people either because they feel like they might hurt them. But now we have truth that yes, some people might hurt you, but not all people will. And they find a way to trust their emotions, and in trusting their emotions, they can form bonds that are trustworthy. They can form intimacy. They can form interpersonal relationships. This is why oftentimes we use group therapy with substance abuse, because they're rebuilding their social structure. They may have demolished it. Nobody wants to talk to them anymore. They've used up their resources, their friends, their family. And now we have a sympathetic and empathetic group of people that says, we're going to help you through this, and we're going to help you restore yourself to where you at least would like to be. Without this trust, without this truth and reality of the situation, people cannot move on from there. So we have this other symbol of truth, liberty, freedom. And I was talking about earlier, one of the reasons we don't want to remember, or we don't want to think about what people have been through, is because this is a quote by Bessel van der Kolk. He's a very famous and prolific expert in the field of trauma. He's a neuropsychiatrist, a psychologist. No, he's a psychiatrist. The victims are members of society whose problems represent the memories of suffering, rage, and pain in a world that longs to forget it. We want to forget that these kinds of things happen. We don't want to remember that on a daily basis, people are murdered and abused and raped, and because it's hard. We all live in a state of denial in order to stay where we're at in life. I mean, if we thought about all the horrible things that could happen in life, we'd probably run out of here screaming, right? So all of us use some denial process to focus ourselves and be where we're at. When you can't do that, it's really hard to live in all these overwhelming emotions. I'm going to play a very short video by Bessel van der Kolk. If you're interested, you should look him up. He's got great resources online. He's got a number of books and videos out. They're really well worth the effort. It's required reading for my graduate trauma class that I taught. But I'm including, and those of you that are interested in the bachelor's program in the fall, we are going to be covering this in some of the courses, so you'll get some of that too. So let's watch a little 5-minute video by Bessel. He's one of my favorites. Oh, crap. Hold on, I got to do it over here. Develop the same neural circuitry that they might have if they had a more structured and safe upbringing. So now sometimes they have this emotional or neurological dysregulation, and these kinds of methods can restore that, and they're like amazed in just a few sessions how they can learn how to regulate their breath, regulate their impulse control, focus their attention on something else, and also and then as a means of not allowing their emotions or thoughts to overwhelm them. This is very helpful for anybody. I think there has been a lack of interest in it because they think, oh, it's so cumbersome, or I'm not a yoga instructor. You don't have to be. You can learn a few simple poses that you can teach your students, or excuse me, your patients. You can just do breath work, which is what I do. I get on the floor, we sit down, we might take our shoes off to get a bit more relaxed, maybe we'll lay down. and then we'll do some breathing. I might tell them a story in group. I'll turn the lights off. I'll use a very measured tone, relaxing, and then we'll engage their imagination. In doing so helps to learn how to regulate yourself, because if you can imagine things, you can create an emotional world for yourself, right? If I think about a beautiful waterfall that I saw when I was in Hawaii when I was a young man, and I go back in there in my mind, I'm calm, I'm peaceful, I'm happy. It happened. Or I can imagine a place that I've never been, and I can go there. Just like when you watch a movie, it can activate you emotionally. These things work, and these techniques are simple, and they're free, and there are no drugs involved, and very simple. And when they start to use these techniques, wow, do they grow neurologically, biologically, psychologically, physiologically, spiritually. And just like when people go to church, they have that sense of community. They have a very joyous experience. If you've ever been to a Southern Baptist church, you know what I'm talking about. A really interesting sense of community connection. And it's so important to remember that we have such better tools now for working with trauma and addiction. And that's not necessarily what's out there. But I'm training you guys. And if you take my bachelor's program, keep pushing this thing. You don't have to take it, but I had this in mind. But I infuse that into all my associate's level courses too. These are branded courses. They're really up to date. And because I work in the field, I know what works, and I have had really good supervisors that help me understand that. But it isn't just the same old things. And I want you guys to be really comfortable and educated with the training you receive, and be able to apply that in the field if that's what your interest is. You don't have to become a drug and alcohol counselor. That's my bias, but you might have another need for this stuff. You can generalize a lot of these skills towards different settings. There's a quote by D.H. Lawrence that I'd like to read to you, because I think it's so important that we recognize a certain aspect of the psyche, just as the body has its own process of healing. And he says that my belief is in the blood and the flesh as being wiser than the intellect, that the body unconscious is where life bubbles up in us. It is how we know that we are alive to the depths of our soul, and in touch somewhere within the vivid reaches of the cosmos, that we are more than our mind, that the body was created without even us knowing how to do it. I don't know how I breathe. I mean, I kind of have a rudimentary idea, but I'm not thinking about, cells dividing and energy process and mitochondrial, systems in my cellular structure. It just happens. And as clinicians, we have to have faith that this being in front of us has some kind of deeper wisdom than we can ever even imagine or think of, and that process of healing is on its way, on its own. And we're there as facilitators, as a support system, as a means of guidance in some cases, but we are not there to fix a problem we don't even understand how it got there. So just like medical doctors, they tend to use the body's natural healing systems to encourage them. They might suppress something, they might introduce something that helps facilitate that natural process, because we have to work with the system. Working completely against it is you're going to fail. Sure. Okay. I think everyone is having to go to the bathroom, but we didn't take a break today. Any questions on that before we wrap up? We just have a few more slides, and I want to talk to you a little bit after that, but no? Okay. So as I was mentioning the quote by D.H. Lawrence, there's another myth that comes to my mind, and this one is of Eros and Psyche. As you can imagine, Psyche is in the myth, she's the personification of the human mind, right? Like our psyche, psychology. And Eros is the personification of human love, or he's also known as Cupid. And in this painting, which is by an Italian painter named Crespi, which is in the gallery in Uffizi, Florence, Italy, if you ever have a chance to travel, I'd recommend going to see some of these great works. They really are a sense of inspiration, and they really helped me understand some things that I was doing in therapy that I had a trouble articulating because they were so profound. And what I learned from this myth is what I take into every one of my therapy sessions, and I try to impress upon my students. And in this experience, Psyche is this beautiful maiden. She's so beautiful that that men are admiring her and paying homage to her, even over Venus, the goddess of love, right? And this inspires tremendous jealousy in her. So she sends her son Eros and says, take care of this woman for me. She is really pissing me off. And so he veils himself. He's invisible. And his plan is that while she's looking at some beast, some frog or toad, he's gonna strike her with his arrow of love, and she'll fall deeply in love with this beast, and it'll ruin her. Nobody will want to be with her after she's been with a beast, right? So he sneaks into her bedchamber, and he takes his arrow and he places it on the tip of her lips, and he's about ready to strike her. Because he's thinking about how he's going to do this, and she wakes up, and her beauty strikes him to such a degree that he is astonished. He backs away from her, scraping one of his arrows on his thigh, causing him to fall in love with her. So now he's in this situation, and he refuses his mother's command. He's like, I'm not going to do what you said. I'm in love with her. I want to be joined with her in marriage, and she refuses. So she sends him away. He's recovering from an injury, and she puts these tests upon her. She asks her to sort these beans or seeds, and the ants help her do that. Also asks her to retrieve a golden fleece from these fiery beasts, and the river gods help her. And finally, after all these different tests, Eros frees himself and returns to her, rescues her, and he goes up to Jupiter, who's Zeus at this time, and demands that they be allowed to be together. He says, I'm not going to shoot any more animals, plants, nothing's going to fall in love, and nothing will grow. So then the earth begins to die. So finally, all the other gods are getting concerned, and they encourage Venus to allow them to wed. They bond them in matrimony for all times, and through this union, through this sacrifice that Eros and Psyche enact for one another, they're saved. And the thing that I learned most from this analogy, this mythic, this living dream that we all share, is that love is the thing that saves the mind. And when the mind is sick, it requires love. Now, we don't love our patients as we do our family and friends, but we do offer them compassion, which is a form of love. And in that compassion, we enact the healing process that the mind naturally has. So that gentleness, that support is so important. And no matter what intervention you decide to use, start with compassion and maintain consistency there. Because if you start at compassionate but you get irritated with them, and then you get mad at them, or you're disappointed in them, now you've betrayed that trust, and they got to start all over again. Or if they ever come back, they might just leave and say, this person's not getting me. And I remember early on, when I was a counselor and I started running groups, and people had said, I've been addicted to crystal meth for 30 years, living on the streets. What do you know about what I've been through? How are you going to help me? They would challenge me. And I didn't know what to say. I'm like, gee, I don't know. That's what I said, because that was the honest truth. I don't know, but I'm going to try. And although I haven't done the things that you've done or been through the kinds of pain that you've been through, I'm a human being. And I experience pain and loss, just like anybody who's ever been born. And I also went to school for 7 years and did 2 years of training after that. It's 9 years of my life that I dedicated helping people. And I have compassion. And I demonstrated that. And I won him over. And I won a lot of people over because I don't get angry when they get angry with me. I stay focused. Okay, this person, really, they're afraid to expose their guilt, their shame to me because they think, well, you weren't an addict, so you're not going to know. So we have a lot of people with the misunderstanding that you should have been addicted to drugs and alcohol to become a drug and alcohol counselor. We got roughly 25% of the population addicted to something. If we have to make sure every clinician is addicted first and then goes through their training, we're going to have a big problem, right? This is a misunderstanding of the situation. What a lot of times comes up for people is they're afraid, like, you're going to judge me. You're gonna think I'm a horrible person when I tell you some of the things that I did or I've been through. I'll never forget one patient I dealt with in group. Her big secret. Her daughter was the product of an incestuous relationship by her father. Her daughter was mentally retarded. She could have aborted this child, but instead she tells the group in her final week what she did. She said she had the child, she loved her, she nurtured her, she developed an addiction of her own, she overcame that, but it was the loving of her daughter that saved her. And I thought that was the most heroic thing I ever heard in my life. And it defined her, and it was not in spite of what had happened to her, but because of what had happened to her that she blossomed, and she found a depth and truth inside her and a strength that nobody could compare to. And my other realization was that love was the key. I know that sounds hokey and I can't prove it scientifically, but I know it's true. And if you do nothing else, if you can maintain that level of compassion towards your patients, you're going to be a successful clinician. If you fail in that, and I will say that we have plenty of research done by Bill Miller's group out of New Mexico, multiple researches that have shown that people's empathy, their level of empathy, the way they can express the empathy towards their patients does have outcomes about how they're going to be able to reduce their use. So there is information that demonstrates and proves that. So it's something that I hope you keep with you for the rest of your days, whether you become a clinician or you're just a human being in general. It really can help you. And we are the first beneficiaries of compassion. When we give compassion, it's a very warm feeling. It's no judgment. I'm just here. I'm trying to understand. And then you're the first person to feel that. And then they feel it. And so it's its own gift that you give to yourself when you're with patients. That's why I don't believe in burnout. If you're doing your work right and you're able to stow your own personal ego and experience this person as a person who has suffered, who has had some tragedies beset in their life, and open them up to processing those kinds of things, you're going to have a great career. If you don't, if you resent your clients, if you think small thoughts, if you think little of them, they're going to feel it, and you're not going to get very far. With that, you put me back on the screen.
So, Mr. Sita, were you always able, that compassionate, that empathetic, or did you learn this through your training? Because some of us have it like an innate.
Sure. I think that, I would say, let's use percentages because it helps. So I would think I was like at 30% compassion and 60% in trying to use my head. Stumbling around, not doing well. And I had some really great supervisors that were saying, it seems like you're really trying to solve this problem and get them, you really care about them, but at the same time, it doesn't look like it because you're trying to push them in a place they're not ready to go to. So I had to learn to develop that sense of compassion. I think I did that through, personally, I had to do that first, because you can't go anywhere with your patients that you haven't tried to go yourself. So you have to do a lot of inner work. You don't have to be perfect, but you have to be aware of some of your issues. I also use art, poetry. I did a lot of my own personal reading. And if you think that the education program is going to be enough, it's not. It's just the beginning. And we're just kind of giving you a little bit of direction. we would have to keep you in training for so long, and also we'd be teaching you things that maybe you aren't interested in anymore. You need to kind of find your own path, and I can help you do that to the level of my abilities, but there's going to be a time where you're just going to have to figure out how to carry yourself through. So no, I don't think I was there. Now, in my general everyday, am I as compassionate as I am with my patients? No. I am grumpy sometimes, I am selfish, I'm human. I like to think I'm compassionate with my students. I try to take the same attitude with students that I do with patients. It's different because we have a little bit more different kind of relationship. I have to grade you. I have to make sure you're ready to work with the public. So there's some challenges there, but also I still try to maintain and understand where you guys are at, because you're still, trying to understand things and learn. But man, if I could be as compassionate and as centered in my therapy sessions than I am with my girlfriend, I would be an amazing boyfriend. But I fall short every time, and I think, man, I know I can do this because I've done it. But then, because that relationship is, it's one-sided. I'm there for them. It's not the other way around. That's what the money's for. Okay. Now that's not why I do it. I do it because I love to work, but at the same time, I do have to open myself up, but I don't have to be as vulnerable. Me and my girlfriend, we force ourselves to be really open and vulnerable, which is really uncomfortable sometimes, and I don't want to be there all the time. So there's more conflict there with my patients, and I've had conflict with patients. I've had people walk out. I heard somebody tell me, go screw myself once. I made mistakes, I've learned from that, and I've been able to get better from it. So I don't want you to be afraid of it. But at the same time, if the basis can be that empathy and compassion, you're going to be so far ahead of anybody else coming out of these programs, because we're going to remember that rather than trying to do something. Because we're always trying to do something. I will tell you, the more I work with patients, the less I do, and the more I listen, and the more I'm present. And then I'm modeling that focused centeredness, and they're starting to say, wow, they start modeling my emotional reactions to their stress. Oh, I don't have to freak out. He didn't freak out when I told him. Maybe it's okay if I can talk about this stuff and not freak out. Wow. And so these things, they just grow exponentially. It's so amazing to watch, especially when you know what to look for. And so thank you for asking that question, Maria. It helped me kind of deepen the discussion here today. Any other questions or thoughts that you'd like to share? Okay. Well, I want to thank everyone for coming out today. I know it's an effort to get here, but I think it's important that I offer these kinds of face-to-face interactions. I am video recording this. Make sure that whatever site you're at, that you get a sign-in sheet and send it to me. Somebody's got to be responsible for that to get your extra credit. If you're on an individual video link, just email me and I'll remember you. If you're by yourself, like I think somebody in Winnemucca's in that room all by themselves. Hi. Just email me so you can get your extra credit. Okay. Thanks again for your time and attention.
Thank you.